Thank you so much for coming to my talk. So the title of my presentation is Will Computer Vision Beat Cancer? Just a bit of warning, we're not able to, of course, cover everything in this short time. Feel free to ask me questions at the end of my presentation, during the breaks, or if you want, you can reach me via LinkedIn. My name is Roshanak. I'm an AI research scientist at a medical tech company called Elekta. So I'm specialized in computer vision and image processing, and Elekta is one of the 3 companies in the world that they make the radiotherapy machines. I will tell you more about radiotherapy and the imaging techniques that we use during the radiotherapy treatment. And yeah, and if you're interested, this is my, I didn't go to the next page. Yeah, if you're interested to know about my current research, my previous academic research, you can find them on my webpage. Awesome, let's start. Computer vision in medical imaging. We know that computer vision has been used in medical imaging in many different fields, and the focus of computer vision on medical and image understanding help us to understand to do lots of tasks that we can do in computer vision in medical imaging, like image segmentation, classification, object detection. And we see these applications every time we go to the doctors. For example, the ophthalmologist, when they get the images, they can understand if somebody from, for example, the vessels in our eye, they can understand if somebody has diabetes or not. When we go to dermatologists, they can detect with the imaging techniques if somebody has, let's say, skin cancer or not. Orthopedics and lots of applications. And one of the most important one, and one of the first application of computer vision in medicine was radiology. Radiology images, there are lots of them, tons of them, CT scan, MRI, ultrasound. And the purpose of them is to visualize the internal organs for us. We have many different types of them because we want to understand different tissues better. And one of the main important usage of radiology images is the tumor detection. And computer vision tools help medics to find out where the tumor is, what's the type of it, and make the proper plan for the treatment. Now, let's say that with these radiology images, a doctor acquire from the patient, and then they understand like the patient has cancer, then they decide to have radiotherapy for the treatment of this patient. There are other ways that we can treat cancer. One of the main one is radiotherapy, or radiotherapy combined with other types of treatment. Now, here is the part that I want to show you. The company I work in, Elekta, that they make this radiotherapy machine, how we use radiotherapy to cure cancer, and how we use these imaging techniques to help us to understand the behavior of these cancer cells better. So radiotherapy or radiation treatment is a cancer treatment, as I said, that uses high doses of radiation to kill cancer cells and shrink tumors. Radiotherapy is conducted by these devices that they are called linear accelerator, or LINAC. They are big, very big. And LINAC conducts the radiation treatment by different particles that they have. How can I tell you? They have large amount of energy that it tries to release the energy when it hits the cancer cells. So we try to kill the cancer cells, and also try to slow down the growth of these cells by damaging the DNA of them. So the thing which is important is that during this treatment, we try to kill cancer cells, but we want to not harm healthy cells. This slide would help you to understand better the whole process of radiotherapy and where this imaging data that we are getting from this machine comes here and how it helps us to do better understanding of what's happening in the body and, of course, do a better treatment. If you look at point 1, we can see like there are different images, different modalities of images. As I said, different modalities try to visualize different information for different tissues. And it helps a clinician to understand what's happening, what type of cancer it is, and how they have to treat that. After having lots of different images, then we can see in number 2, a very expert clinician. Usually they are radiotherapists, oncologists that they are trained for years. They sit down and draw the shape of the tumor on each slice. So usually the medical images are in 3D, even 4D, because we want to see exactly what's the location and what's the shape. And the doctor spends hours and hours to go through all of these slices and draw the shape of tumor manually. The interesting thing is, 2 different doctors, they can draw different shape. Slightly different, not very different. Or the same doctor who comes next day, the shape that he draws can be slightly different. So it's a very important task. As I said, we want to just kill the cancer cells and keep the healthy cells. So that's why the amount of time they're spending and the amount of precision they're spending is very important. And then after the doctor draws the shape of the tumor, then we can plan the treatment. We can find out that what is the shape of the tumor and how much, there are medical physicists that they calculate and see like how much dose they have to deliver to that to be able to kill those cancer cells in how long. Usually the radiotherapy is done in many sessions. For example, for lung cancer, it can go up to 30 days, 4 to 6 weeks. And the interesting thing is, during the whole period of the treatment, we use the shape that the doctor drew before treatment starts. We hope the tumor shrinks, but it's not happening in all cases. Sometimes the tumor might expand, it might even react and might even get bigger. So now that we have the shape, we start the treatment, or each time we have the treatment. Would you please run the video on the number 4? The one on the top one, the first one. Yes. So now we put the patient inside this linear accelerator, and this machine radiates the tumor based on the shape that the doctor drew. I want to ask you guys a question that how we find that tiny tumor inside the patient body, and we try to radiate that exact location. It's very complicated, right? Because human, let's say it's a big object, and the tumor can be very tiny. And as I said, even 1 pixel left or right can make someone deader, you know? And it's very important. So when we put the patient to this in the machine, they are kind of imaging tools we have called cone-beam CT, a kind of CT, very low quality, but it's good enough for us to understand what's going on in the body and kind of register the position of the patient to the device. Then we can understand, like, okay, this is the right location, we can radiate this part. And the video which was below, it was showing that when the LINAC rotates around the patient, it tries to rotate and shape the beams from different angles in a way that it's more efficient. So we are not just radiating one shape from all angles, or we are not delivering the same amount of dose from all angles. It's very important. What are the organs just before the energy reaches the tumor? What is the shape? And lots of things that we have to consider. Another thing that I want to emphasize again is the whole process, we use the same shape. But we are in radiotherapy, we are working on adapting the shape that each time that the patient goes for treatment, we try to even change the shape. Let's say for someone that the tumor shrinks, we can change the shape. Or let's say when its tumor expands, we can again change the shape. So this figure would be able to show us that these regions that I told you that we want to radiate in a tumor which is in the brain. So the good thing about brain doesn't move. The tumor in the brain would be always in the same location, right? So we don't have that much problem when we want to radiate this part. So the amount of dose that we want to deliver, it's fixed and it's the same location. But when it comes to the parts of the body, like here in the lung, that the patient is breathing, for example, so the tumor shape is changing, right? So let's say this linac that it rotates around the patient, it tries to find those exact shape, but the thing is the shape is changing. And we have to, with advanced imaging techniques, we have to reduce margins and further limit those to the healthy cells. This video, if you please, it's running, yeah. We can see like that some part of our body, we can't, how to say, resist the movement of the organs. And that's why adjusting and adapting to the patient movement during the whole course of delivering the dose is very important. And we have to have a seamless online plan adaptation. So now that we understood how complicated is radiotherapy process, I want to ask you that, do you think that with all this amount of energy, effort, accessing to expert radiotherapists, radiographers, the time they spend, the cost of the treatment, do you think that this treatment would work for all patients? Or let's say even the patients that they have successful treatment, are they being all cured from cancer? The answer is that no, and we still need to improve this. And the reason for that is because the treatment, we just look at all different patients the same way. But this figure tries to maybe visualize what I want to try to tell you better. We can see like there are different guys here that after treatment, after radiotherapy treatment, they got a skin reaction, they got bruises on their skin. And this makes us wonder that maybe we are delivering, I don't know, more amount of dose to these patients that they don't need it. Maybe when the doctors were planning the treatment for these guys, they saw like that, okay, the shape of the tumor, I don't know, for example, the class of the tumor that they have, it's like the other guys, and then they planned the same treatment for them, the same amount of dose be delivered to them. But the thing is, we can see like their skin is reacting. So maybe this dose is harming some of these healthy cells on the way to reaching the tumor. And maybe we have to consider some other information beside the only tumor shape or tumor type. For example, maybe people who have different skin color, people who are having different age, different gender. So maybe they should be treated differently. And we have to have different plans for treating them. And this brings us to this question that why cancer is not cured yet. Although we see like medicine is very advanced, of course there is room for improvement, but with these advances in imaging techniques, we can do much better. To me, the reason that to answer to this question is obvious, and because we use the same recipe for all patients. There is no personalization is involved in the treatment, and it's because we are limited in the amount of time and the amount of access to the experts. And even if we don't have problem with that, each of these clinicians, they are specialized in different field. But if, let's say, somebody wants to consider their blood test, somebody considers, it's very difficult to merge all this information together. So AI is the key. AI is able to understand this personalization much better than human, because AI is able to access different data and be able to interpret them much better than us as a human. To understand what I'm trying to tell you with personalization, let's look at this figure. This figure, let's say, is just a picture that, let's say, it's the people in this room. We are all different in the matter of our gender, our age, skin color, the diet we have, the sports we do, the amount of exposure we have to sun. And it makes us different. So it's not really ideal that we use the same treatment for all of us, because when we get sick, we see like people from the same disease, they have the different level of sickness. And some people, they get treated much easier than the other ones. For example, we hear that some people in some part of the world, there are less potential or more potential to get a specific type of cancer. For example, Southeast Asian women, they are less potential to get breast cancer compared to European women. Or among European men, the Italian men are less potential to die from prostate cancer. So what is it? Is it the environment they live in? Is it their gender? Is it their race? There are lots of factors that we are trying to understand, but we don't know exactly what it is. And maybe it's a mixture of different factors. And if we look at this figure, we can understand this concept that we use the same treatment for all much better. So these different people that the doctor says they all have colon cancer, doctors decide that they send them for the same treatment, same therapy, let's say same drug. But these treatments, when they are designed, we know that it wouldn't work for all. We hope that, and of course with this explorations that we do, we understand that it works for most of people, but of course we know that for some people it has no effect, or even it can have adverse effect. But how if we are able to personalize the treatment and we understand each one of these individuals better and make the treatment better in a way that it's able to work for everybody and everybody have a good response to that. This brings us to personalized medicine. Personalized medicine is also called precision medicine, P4, or stratified medicine. It's basically a medical model that separates people into different groups, and it makes different medical decisions for them. let's say the treatment, the drug, for example, that it's being specialized for different individuals that they have the same disease. Personalized medicine can be also not only used in the treatment, we can use it in prevention, in diagnosis, and by understanding more information about each individual, we can even do like detect lots of these diseases much earlier that they happen. And I told you, like, we believe that AI would be able to help this better than human. And the reason for that is AI is able to understand and to kind of look at lots of different data at the same time and also find out the pattern in different type of data that we have and interpret that much better. And we don't need to have access to lots of different experts in the same time, in the same room. And this would be really helpful and would be the goal for us to bring us into the something like this, that with the same guys, with the same cancer that they had, now we don't need to only look at their, for example, images that we have, their CT scans. We can look at their blood tests, we can look at their demographic information, their genome information, lots of different data that we have from a patient that is kind of ignored most of the cases when we send them for treatment. And based on that, we can categorize them in different groups, find the best treatment for each one of them, and then have a more effective treatment for each one of them. There are benefits of using this for sure, and of course challenges. The best benefit would be that with machine learning, we can deal with large multimodal data sets to identify these hidden patterns that sometimes the pattern of, let's say, of one disease can be hidden in one set of the data, but it's easier to understand in the other one. For example, sometimes there are people who are having very advanced breast cancer, but it doesn't show it very well in the scans of their, let's say, mammography. But there are lots of other information that the doctor needs to understand them. And when we have it with something like machine learning, it's easier to understand that. And another benefit, it would reduce the burden on the healthcare system as well. We don't need to access this, as I said, the limitations that we have with accessing the doctors. As for challenges, optimization is one of the main important things that is required. Optimization of the application. And another challenge would be that the stakeholders, such as doctors, now we need them to have a basic understanding of these concerned domains and how to use them and how to improve that. I hope I was clear when I was talking about combining different types of data for personalization. If it wasn't, and how AI is able to do that, or we hope that it would be to do that. If not, I'll just give you a very simple example here that for the guys who are not from medical field, they understand what I mean, what different type of data I'm merging that. So let's say this picture is, we have a picture of a person. Let's say we can identify who is this guy, right? And if we know this person, and if we heard his voice before, we can still identify who is he. So our brain, it can understand and it can merge different type of information at the same time. So let's say we just only see the picture of this guy. We can understand, we can still detect who is he. Or if he calls us, so we don't have the information of the picture, we can still understand who is this. So in the absence of one of this information, we can still, our brain is able to do a good task. But what the problem is still, I mean, in AI, there have been lots of improvement, but still we need to do more work on it to merge different type of data, to be able to replace one of these data with the other one. And that's one thing which is very important in healthcare. For the example that I told you about breast cancer, if the pattern, if the information we are looking for is hidden, is not there in one of these source of data that we have, then we have to be able, so we should be able to find it from the other resources. And coming back to radiotherapy, when we have lots of different information for the patient, let's say their blood tests, their urine tests, their genomic information, and so on, we can make a better understanding of the situation of the tumor. We can segment it better. We can classify it better. We can do a better planning for that, for the dose delivery. And of course, we can do a better treatment, which is more personalized for that patient with more effect. This is the end of my presentation. I hope I was clear.